Good day, everyone. I am Lubalethu Dube, and today I am joined by Dr. Tebogo Phaleng. So, Dr. Tebogo Phaleng is a medical doctor, has been in the industry for quite a few years. Interesting fact about him that I found out today is that he is afraid of roosters. Doctor, what happened?
Yes, we had, when I was growing up, we had a rooster at home, big one, and two dogs,
Okay.
German Shepherds. And the rooster just learned to behave like a dog.
Oh my God.
Would run with them, and I just walked into the yard. I was coming back from playtime, walked into the yard running, and he just followed me to the kitchen door, climbed on top of me, and just assaulted the hell out of me.
A rooster?
It's been it's one of those things, and I've never wanted to be close to chickens or roosters ever again.
That's a very valid reason.
It's a very traumatic experience.
Of roosters.
I was about 4 years old.
Oh my God, no.
It was terrible.
Oh, that's horrible. I'm so sorry. I'm so sorry. So I'm really excited to have this talk with you because I've been meaning to have this conversation, but what better way to have it than on screen? You're actually heading up a new division at Insight, and it sounds really exciting. Do you want to just share on that?
Yeah, quite exciting. The unit is called Strategic Health Governance and Clinical Consulting. Very new team. It's a team of 4 at the moment, likely to be upwards of 10, 15 by the new year. So we're quite excited. Good pipeline of clients and, exciting work. We focus on strategy design, health governance, clinical advisory, health policy and regulatory affairs.
Okay.
Right through the spectrum in a strictly advisory capacity. Our clients are medical schemes, healthcare providers. We've done some work for non-health players like the banks, and we're hoping to get do some advisory work in the not-for-profit and NGO space as well, probably public sector. So we're not limited to medical schemes. Yeah,
that's very interesting. I can't wait to see what we get up to as Insight. So your topic today was good governance, a catalyst for improved medical scheme performance. Do you mind sharing just a brief overview of what inspired that talk, and then we can go into the details of that talk?
Okay, so I think governance it's got these negative connotations. It's, people think governance and they think, trustees and, admin, lots of admin that goes nowhere, etc. But governance is a key element of organizational performance, right? Otherwise, you're not able, you can have a strategy, you can have an operating model. If you don't have a, governance and accountability framework that guides that, and I think it's often underrated in terms of its impact. And a lot of, if you look at even within the medical schemes environment, if you look at schemes that have gone into curatorship, a lot of times it's governance related issues. Some of those schemes actually have very healthy surpluses and reserves, but have, specific issues around governance. And one of the slides I showed actually is that it's got an impact even at systemic level if you don't get it right. So it was just a different take on performance within the health sector and, a key factor that's often ignored.
Yeah. I really enjoyed during the talk that you mentioned just the health sector and how it really impacts the prosperity of a country. Do you want to just touch on that?
Yeah. I mean, I think if you look at the most prosperous nations, people often think they have good health systems because they're wealthy. But actually, it's the other way around. Look at countries like Norway, Denmark, Japan, etc. They perform well economically because they invested in health, education, and social empowerment, part of, of the prosperity index. And through that, they get populations that are driven, that are healthy, that are educated, and they just outperform everyone. And they live longer, right? So they can stay economically active for on average, a longer period of time. So the country in that, it becomes quite competitive, economically speaking. And that's how they achieve their kind of, economic gains. So the health sector is quite an important, critical factor in a country's
So where does South Africa sit when we're comparing it to these other nations?
South Africa ranks 75th currently in the 2023 ratings. It's a bit disappointing because we've actually gone the wrong way. I showed in my presentation that we were ranked, I think, 62 about 15, 16 years ago. And we're slowly going,
backwards.
Mainly due to the socio-economic empowerment metrics, health, education, living standards, and then also from an inclusion point of view, our rates of crime are impairing our scores. And then we've also had our governance ratings have also slipped. So I think a combination of all of those factors and the state of our economy have actually contributed to us, going in the wrong direction, which is quite disappointing.
It is very disappointing, yes. So how do you feel that governance is very important when it comes to dealing with these issues and getting South Africa back on the right track?
Yeah, it's an interesting question. I think, look, I think governance just deals with just beyond setting a strategic direction and aspiration about policies, etc. It's a disciplined approach to saying, these are our policy intentions and this is our strategy, but how do we hold ourselves accountable to deliver on those aspirations? And I think that's the key thing.
The key.
To set goals and milestones, etc. But without that accountability element is meaningless. And I think governance is a team sport. One of the concerns with the NHI bill, which is why we think the governance model that's suggested in the NHI bill is problematic, is everything resides in the minister's office. Minister appoints the head of the NHI. He will appoint the NHI executive team. He appoints the board of the NHI. The NHI fund is not going to be regulated by the CMS, which is the regulator for health funds, medical schemes. It's not even clear who will regulate the NHI. So just that concentration of power in the minister's office is a great worry. All other technical issues aside, I don't think it would be appropriate for one office to sit and preside over a health fund of 500 billion rand per annum.
And it's presided by one person.
Eskom is 205 billion, right? So the NHI fund, as a fund, fully implemented as envisaged by the bill, would be roughly 2.5 times the size of Eskom. I don't think the country can afford that level of concentration of risk. And it's a governance issue. The governance model is wrong. It's inappropriate, I think, for what we're trying to achieve.
That's very interesting. So you really touched on an aspect where you can see some warning signs on a governance perspective. In your talk, you also spoke about other warning signs that you see in companies. What are the key warning signs that highlight that there's a problem here?
Yeah. Leadership dynamics, just decision making, lack of strategic direction, lack of clarity around, ambition and purpose. Oftentimes there's a breakdown in communication channels at leadership level, but within the organization. There's all sorts of issues around financial mismanagement, operational mismanagement, lack of innovation. They organizations that are poorly governed tend to want to stick to kind of today's work. We just chug along because there is no oversight. There is no governing body that says, let's stretch, let's aspire for more, let's hold ourselves accountable for better results. So everyone just focus on the here and now. There's usually an opaque kind of setup, no transparency in terms of reporting, and just a lack of focus on customer value or stakeholder value generally. And, these are factors that when you see in an organization usually ring alarm bells. If I see 2 or 3 of those, I'm already worried. Before I even check your financial statements, I have a clue that things are not all right. And oftentimes we're not surprised when we look at the detail.
That's interesting. So when an organization wants to fix their governance issues, when we go in to fix the governance issues, what are the main things that we go into? What are the tasks we perform there?
So think specifically in health. I'd say look at governance not just as structures. Of course you need structures. You need the board of directors or board of trustees. You need the oversight committees, etc. So that's necessary. So structure is important. You need processes that speak to accountability and advisory functions to the board and the oversight committees. But you also need a focus on outcomes, specifically governance outcomes. And our simple framework there is to look at governance from split it into 3 domains. There's normal corporate governance issues, quality of your leadership, transparency, reporting and accountability frameworks, etc. Then there's the clinical element. If you're in healthcare, your governance framework has to speak to clinical outcomes, right? Because then that's the business of health ultimately. And lastly, financial risk protection and financial performance. And what we try and do is then look at an organization's performance, look at their strategic objectives in that light, and then say, based on these objectives, this is perhaps how you should be monitoring yourselves, holding the organization and all the people who work within it accountable for delivery on the objectives. And work from there. It's actually quite simple once you do it that way. And we're hoping to kind of build a tool that's easily replicable that we can share with our clients. We've tested it with one successfully.
So you've tested it with one successfully. Do you want to just share the outcomes of?
Speaking without their permission, and I anonymized that slide because I'd meant to engage the client beforehand, but they I just engaged them after the talk, and they were quite happy that actually they were saying, why didn't you mention it's us? But they had gone through a terrible period of massive governance failures, executive level misconduct, the finances weren't looking good. They were below statutory requirements in terms of reserves. They'd been underpricing their benefits for a number of years against actuarial advice. So financial performance had dipped, and the clinical governance metrics were also not looking great. They had massive access gaps, for example, in their network. So they did a whole lot of contracting with providers, but they were sitting with coverage levels of 40% in some of their networks, So it was, things like that. It just overall wasn't a good situation. And that's why the board at the time decided we're going to do a strategic review. We'll have a strategy. We must review our operating model, because they wanted to also just position themselves in view of, the policy changes in the country. And they then made some very tough calls around whatever our strategy design is, the organizational design must follow, right? And the duty of the board then is to make sure they oversee the strategy, they monitor alignment between strategy and ops, and they were very meticulous in setting that framework. And the results over a 6-year period is they now surplus making. They've got a few products that are, performing quite well. Their membership is still growing. Their reserves are above statutory requirements. And if you speak to the principal officer and the executive team, they feel the cohesion between EXCO and the board is very strong and much more, not without struggles day to day, but generally a far cry from where they've come from. So, it's a good story.
It's amazing. It's a good story. Well, thank you so much for having us. Do you have any final thoughts?
Not much, really. Thank you for having me.
Another insightful podcast. Thank you so much for tuning in.
Thank you. Cheers.